Welcome to episode 211, Dollars and Cents, Connecting Financial and Emotional Wellness in Therapy, featuring Dr. Traci Williams. Make sure to subscribe to be alerted about future episodes by Clearly Clinical. Learn, grow, shine. Hello to our listeners. My name is Beth Irias, and today we are talking about a topic that I think makes many clinicians and clients uncomfortable. I am thrilled to be joined today by Dr. Traci Williams. One of her specializations is around financial therapy, and I am just so interested in wanting to learn more because truly, I think there are only a few topics that you can bring up with people that makes them uncomfortable if we don't talk about that. And definitely money is on that list. Thank you so much for joining us today, Dr. Traci.
Absolutely. You're welcome. I'm happy to be here.
So before we dive into this fascinating and big topic, why don't you tell our listeners a little bit more about you and how you came to learn so much about this?
Yeah. So first of all, I like to address the elephant in the room. Yes, I do have an accent. I sometimes joke that I bought it on eBay, but no, that's not the truth. The truth is that I'm from Trinidad and Tobago, but I did all of my education here in the United States, and I am based in Atlanta. My original path was to become a child psychologist. I specialized in kids, teens, and families when I went to grad school. However, with my practicum placements and my internship placement, I ended up working kind of across the spectrum, kids, teens, and adults. And somewhere along 2020, it was in the very early stages of the pandemic, a friend of mine said on Instagram, "The stock market is crashing. Now's the time to buy." And I had absolutely no clue what that meant, but I went and I bought an individual stock for the first time. And from there, I became very interested in money, and not just in money, but what people were doing with money in the context of a crisis. So if you think back to 2020, that was a very interesting time where money is concerned. A lot of people lost their jobs. There was food insecurity, housing insecurity, and then you had the whole GameStop craziness that happened, the Bitcoin stuff that happened. With people being at home, there were a lot of articles out about an increase in day trading as a coping skill for the lockdown that we were in. And so I was just interested in how money played a role in terms of human psychology and what we do with money. At that time, I was working at the Children's Hospital here in Atlanta with little ones and their parents, and across the socioeconomic spectrum. So I had parents who I was helping figure out how to access food, what days of the week their school was going to be offering food. And on the other end, I had clients who were riding out the shutdown at their vacation beach home. So it was very poignant for me in that period of time that money is not just money. There is emotion tied to money, and it definitely influences what we do. And so from there, I started digging and found the financial therapy niche. There is a certification through the Financial Therapy Association, and I completed that alongside my board certification in clinical psychology around the same time. And now here we are.
Fantastic. Thank you for shedding light on a topic that I think for many of us we haven't even considered. And speaking as a private practitioner, it is really interesting to me just simply how for all of us, our feelings about money run very, very deep. Our belief systems about money, about power, about influence. Obviously, you're way more expert in this than I am, but it seems like such a core part of therapy. But because our culture says do not talk about money, to do so is ill-advised or crass or whatever judgy word you want to insert. It's really hard to break through that.
How often do you talk about religion or politics with your clients? probably not much, and money even less so, right?
Yeah, I feel like now more so conversation about religion and politics, and maybe that's the tide that's shifting therapeutically, is like that we're talking more about sex, talking more about money, talking more about the things that maybe prior generations would go, oh, you talked about what with whom? But certainly high on that list is money. So where should we begin today, Dr. Traci?
Oh my goodness, you hit the nail on the head. Our family experiences shape what we do with money, how we think about money, how we interact with money. I had a client earlier today. She is an immigrant. Her parents immigrated, and she is a professional. She's studied hard, she's high achieving, and she's really struggling with basic financial literacy and having a lot of shame and guilt around that. And when we started to probe just a little bit, she shared that in her family, it was not acceptable to talk about money. And at the same time, because they're an immigrant family, the family members in their country of origin turn to them for money because they're now in America, the land of opportunity. So there are these mixed messages around money. We don't talk about it, but yet we're meant to provide for the people we don't even live with. And so that's a lot of stuff to unpack, right? We have thoughts, feelings, behaviors around money. And that's what financial therapists do. We help people shift how they think about, feel about, and behave with money so that they can have a healthier financial relationship. And that can look different for different people. It could mean you have a ton of debt and you don't know how to get out of it. I have a client who is basically stuck, frozen in space. If we think about the fight, flight, freeze response, her response to her debt has been, I am frozen in space. I don't know how to deal with this. To the extent of not opening accounts, not checking accounts, not opening the mail because she doesn't want to have to deal with it. And so for me, I have to work on the response before we can even tackle what's going on with the money. It could also look like people who are overspending, and you see that a lot with say someone who experiences manic episodes. You can see people who neglect to follow up on their finances. Say, for instance, they have major depression. Couples who are not on the same page. People who have gambling addiction and hoarding concerns. And all of those things are connected to money. And us as clinicians, we need to be aware of that, because whether you're addressing it or not, money is showing up in the therapy room with you. Yeah.
Going back to a term you had mentioned, financial literacy, that has an implied definition, and I would love the formal definition, but also like for the average person, where is training or teaching about money coming from?
Unfortunately, if your family did not teach it to you, chances are you didn't learn it until you went off and tried to learn it on your own. Thankfully, the education system is finally catching on to this, and several school districts are now shifting to including financial literacy in high schools, which I think is great. But what we know in the financial therapy space is that most people's understanding of money begins to shape in early elementary school. So high school is probably a little bit too late. If you think about it, little kids know that things cost money. When you go to the store and you tell them, no, I don't have money for that, they start to shape a concept around money and what they can get, what they cannot get. If they're told no all the time, then they may realize, okay, well, maybe we don't have money. And then what does that mean for my security? And that can lead to beliefs later on in life. So financial literacy is just the basic understanding of money, how it works, and how you manage it.
So you had just said elementary school is really when people start to get a concept of money and its relevance and how we operate in society and how the world treats us and all of that, with primarily family being the education around finances. I am going to go out on a limb and guess that there are not that many families that have any children's books on their shelves about financial literacy. So does that basically mean that most of us are not financially literate?
Yeah, unfortunately. Yes. I
thought that's where we were going here.
Unfortunately. I mean, we learn things along the way, right? But most people don't know how to budget. Most people don't know how to balance a budget. Most people don't quite understand how much they should save. I mean, you should save is something that is drilled into our heads as a society, but most people don't quite know how much or where or how to keep track of it. Most people don't understand the stock market or investing or planning for their future or protecting themselves and their family through appropriate insurances and so on. Most people don't know that stuff. And so as a financial therapist, I'm not just looking at the emotions and the thought history, but also where are you in your understanding of how money works? Because that influences things. If you don't understand how money works, you're going to feel overwhelmed. I have a client who feels embarrassed because she doesn't understand how money works, and she's a six-figure earner. So it definitely runs deep.
And I would assume as you say that about the education, a whole lot of this is also related to sociocultural norms, gender training. Can you speak a little bit about that? Because to me, there's a huge diversity component here.
Yes, absolutely. So some cultures, it is even more taboo than the general culture to talk about money. In some, it's cultural norm to help your family members with figuring out money and making sure that they're on the right track. For some cultures, it's the expectation that you help the extended family financially once you're capable of doing so. With women, we know that women were not allowed access to the financial industry until relatively recently, if we think about it. And with that comes a catch-up period, which we are still in. Also, we have the wage gap. So we know that women tend to earn less than men do on the dollar. We also know that the LGBTQIA community tends to earn less than non-queer adults in the community. We also know that folks who have disabilities have specific things that impact their money too. And is that taken into consideration? So yeah, there's definitely a lot of discussion around diversity and diverse needs when it comes to money and managing money.
One would assume then that financial literacy is most often achieved by folks with the most privilege. Is that true?
Yes.
Okay.
Absolutely true. And the unfortunate thing is the gap between those who have and those who don't have continues to widen. And we know that that gap is especially driven by race. Whether we'd like to admit it or not, it is true that most of the people who have are cisgender white people. And so what needs to happen is not just an understanding of that gap and why it exists, but also help in making the playing field a little bit more equal.
So taking this conversation just even about the establishment of financial literacy and the idea that most of us don't have it, I'll just be honest right here. In terms of knowledge of the stock market, I'm still just sitting there going, "What is this weird magic?" So I definitely do not hit that check mark of financial literacy on that note.
And there's absolutely no shame in that. I tell people that I completely get it. I am an immigrant. I moved here for school. So I did not have family here to show me the ropes. When I got my first retirement plan, I reached out to a friend of mine and I was like, how much am I supposed to put in this thing? And that's how I found out that your retirement plan is invested in the stock market. I had no clue. I had no clue. So yeah, absolutely. If no one showed it to you, how are you going to know?
Thank you for normalizing my ignorance. This idea of personal finance and therapy is so loaded, and yet money is at the core of what therapists do, because the vast majority of us are doing the work in order to make money. People are generally paying us, or an insurance company is paying us, or a third-party grant, for example. Can you start just there of like, tell me about money and therapy and power, because it just seems foundational to the core of any service industry.
Yeah, I know that we are at the absolute beginning of having this conversation because of social media posts. And I'll explain what I mean. Whenever anyone makes a social media post about therapists making a lot of money, or that they should make a lot of money, or being a private pay only practice, you then have lots of people in the comments who have very strong opinions.
Yes.
Money is emotional. Personal finance is personal and money is emotional. I say that at least twice a week. So one of the things that we need to recognize as therapists is that a lot of our training around money in terms of our profession came from what we have been told about therapists, whether it's when we were in grad school or just from society in general. I remember when I was in grad school, one of my professors talked about us having a bleeding heart. And if you have a bleeding heart, then you don't necessarily make a lot of money. I have experience in the community mental health space. And while that is an absolute godsend of a resource for people who wouldn't be able to access mental health services otherwise, unfortunately, a lot of therapists in that space tend to be overworked and underpaid. And there is a mindset around the work that we do. You should be doing this work because you care about people and you want them to improve their lives. And yes, I absolutely agree with that. And also, how about your life? Do you feel like you are cared for? Are you financially cared for? And that's a question that I ask therapists to consider. Does that mean jump off of insurances? No, of course we need insurance for people to be able to access mental health services. But if you choose not to accept insurance, that's okay too.
Thank you for that quote. Personal finances are personal. Because you're right. This is really hotly contested. And goodness knows, just the setting of fees for a group practice, for a private practitioner, that's controversial. You know, I remember at a point in time talking to someone who identified their work as concierge therapy. And I said, I'm really curious, how much does that cost? And like my jaw hit the floor. And it's still like staying with me. And it's like, we all have so many beliefs about how money should be used, how it should change hands, what's too expensive. And then it opens up kind of this whole can of worms about ethics. And that's something I see on social media of like, it's so ethical or unethical if you charge this much, or blah, 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 or if your cancellation policy is. And the fact of the matter is, a lot of this stuff is like in an ethical gray area. And it's highly interpretive. It's not, I think that's part of the complexity of ethics, is it's not law. It's not defined that says this is legal, this is illegal. Ethical is kind of inherently gray. We as clinicians are almost always talking about money with clients from the onset of our contact with them.
Yeah, absolutely. You ask your clients where they work. I mean, that answers the question right there. Because if I say that I work as a janitor, that paints a picture in your mind of what I have. So whether we're talking about it or not, it's there. I take it a step further in my intake paperwork. I actually include, when I'm seeing someone for financial therapy, I include a table that lists physical sensations. And I say, when you think about your financial situation, what do you feel in your body? And I also include a table that includes emotions, a list of emotions. When you think about your personal finance, which emotions come up for you? And that has been so eye-opening because it can definitely range. I've had people say disgust. We've talked about shame and guilt. That's really common. But I've also had people say hopeful. And that's also good information to have too. I think that for any clinician, it is important when you're starting to work with someone to understand what their money situation looks like and how comfortable they are with it, because that can also inform your work with them. If they're worried about money, then that's definitely going to impact their mental health. Mental health and money are very closely tied.
In thinking about the way that we think about money, looking at it from an intergenerational perspective, it becomes clearer that money equals security. At least that's what we tell ourselves. Money equals power. And there are plenty of studies that I'm sure that dispel some of those myths.
Yes,
but
it's the illusion of security.
Yes. If I have a lot of money, then I won't get sick, or then I'll have adequate social support, and these things that don't actually hold up. Which money can solve a lot of problems, but it can't solve all of them. But this seems like really so foundational. I'm thinking about working with clients around jobs where they're absolutely miserable, and they may be very financially secure with tons of money and savings, and they're miserable and can't leave because of the fear that there may not be enough money. And that to me goes back to kind of the epigenetics and looking at these really deep multi-generational belief systems around famine, around security and freedom. These are not small concepts.
No, they're not. Most definitely not. These are big. They're systemic. They're multi-generational. So I do not anticipate for my clients that I will solve all of their problems, because I cannot. I can only help them to improve their lives just a little bit. And hopefully that has a cascading effect.
When you are working with someone, knowing what you know, how is your assessment different as someone who specializes in financial therapy and probably injects this element into your work regardless of whether that's why somebody is seeing you?
Yeah. So one thing that we know as financial therapists is that there is something called the money scripts. It was created by Ted and Brad Klontz. They are psychologists. And it basically says everybody has this kind of personality, this script, this blueprint for how they view money. For instance, if you are money avoidant, you tend to not want to talk about money or look at your bank statements like I was mentioning earlier. You may neglect taking care of yourself financially. That is just an example. And so when I am doing my own case formulation, one of the things that I am considering is, what is this person's money script and where does it come from? Oftentimes, of course, it is based in childhood experiences, but not necessarily always the case. For instance, with the pandemic, that has definitely impacted how people view money. Some people who had savings accounts in the pandemic may have drained them, and now they feel like they need to have way more money, maybe even hoarding money, just so that they feel more secure in the event that something like that were to happen again. So I am looking for money scripts. That's one thing. I'm also looking at the numbers. And this is something that most therapists would not do, and probably should not do unless you have specialized training in this area. but taking a look at what are your accounts. If you have debts, what are the interest rates that are on those accounts? How much are you actually paying towards that? We can create a debt overview, a debt payment plan. We can talk about your goals for the future and then determining how you would financially put yourself in a position to move towards those goals. And of course, as necessary, I would refer out if it's a financial provider that you need or a tax provider or whatever the case might be. But that tends to be how my assessments go.
I would venture to guess that many accountants and financial advisors find themselves operating as inadvertent mental health therapists because these topics are so loaded. Can you go back and speak more about money scripts?
Yes. So, yeah, I have heard from lots of financial advisors. Psychology shows up in their room just like money shows up in ours. And hopefully they have the skills to be able to handle it. One of the things that often happens is that they feel like they are not making progress with their clients because the clients are stuck. And usually the clients are stuck for some emotional reason related to the money that they might not have necessarily uncovered because that's not their lane. So with the money scripts, you have a series of ways in which you view the world when it comes to money. And it is possible to move from a space of having an unhealthy relationship with money to having a healthier relationship with money. Ideally, you would want to move towards more security when it comes to money. And security means you are not necessarily emotionally activated by talking about money or looking at your accounts. For you, that's just a regular thing that you do. And for most people, they're not there. You can have people, like I mentioned, the avoidance, that's one end of the spectrum. You might have people who worship money or worship status, tie their self-esteem to how much they have or what they have or needing to have the latest and the greatest. And those things are fine if you're financially able to do that. And so the ultimate goal is really to help people recognize how they have been thinking about money without necessarily realizing that that's how they've been thinking about money, and then help them move to a place where they're more secure and more stable and more responsible.
As we're having this conversation, it's apparent there's so much difference between the haves and the have-nots. So how upper middle class family conceptualizes saving for college, for example, is very different than someone who has a lower socioeconomic status and is concerned about being able to pay for basic necessities and manage the heating bill after a tough month and cold winter. How do you approach those two different paradigms? Because one is born out of basic necessity and the other is born out of allocation of excess.
Yes, absolutely. Either way, they have a relationship with money, whether it's a healthy one or an unhealthy one. You can have a ton of money and have an unhealthy relationship with money. You could have a very small amount of resources and have a healthy relationship with money. So I keep that in mind. When I work with the media is very interested in financial psychology. Because they have noticed that it's ubiquitous. It's applicable to a lot of people. And one of the things that I have to mention all the time is the spectrum, because yes, you do not want to speak just to one audience. You want to speak to a broad array of people. For me, I think about what are the resources that you currently have and how is it meeting your needs? I mean, I think of Maslow's hierarchy, right? Are your basic needs being met? And if they are, okay, what's on the next rung? If they're not, I did a social work minor in undergrad, so I can't help but become a social worker when I need to. If your needs are not being met, okay, how can I point you in the right direction so that you can get those needs met?
So when thinking about meeting those needs, you had said earlier, and I appreciated the disclaimer of like most therapists are probably not qualified to do this. For clinicians who are not specialized in financial therapy, and we're going through this work about Maslow's hierarchy of needs and where are you? Are your needs met? Basically, where is wiggle room? Do we want to talk about investing, things like that? Where do you see the line between, yes, this falls under the purview for your standard social work or therapy or counseling relationship, and then like this crosses over the line and this like, no, this is really highly specialized? And I know I have that trouble sometimes of like, where do you draw that line between what's in our wheelhouse and what's now out of our scope of competence and out of practice?
Absolutely. Yes. And that is not an easy thing to answer. I wish that were a yes or no checkbox. But there is that gray area. And so you do need to check in with yourself on, is this something that I am competent to speak on and help with? If it means that your client is talking to you about wondering if they might have their house foreclosed on and you are not at all competent in that area, then you probably should not be giving advice in that area. But for therapists, it's important to know where to get help if you need help. If you are not competent in this area, the Financial Therapy Association is one place that you can look. There is also an accredited financial counselor. That organization is also a good place to look. But generally speaking, I think it is okay for all clinicians to be comfortable with talking about your client's everyday life. So are their utilities on? Great. If they are worried and it is related to something financial, sure, you can ask more information. You may be able to help. But if it's really technical and a little complicated and possibly involves a lot of numbers, then that would be a sign that you should probably refer.
Thank you. When thinking about financial stability or financial concerns, can you speak a bit about our personal finances and relationship to mental health? Like you already mentioned, for example, how we might be spending money if we're in a hypomanic or manic phase of a bipolar disorder, for example. If I'm thinking about the diagnostic manual, I can pretty quickly come up with any number of diagnoses that involve money behavior. Mm-hmm. So for you, is that like this automatic thing that you're assessing as like, you're like asking about money and in the back of your mind, you're like, okay, go to page 697 on the DSM.
Yes, you're right. I mean, when we were in grad school and we were learning like case conceptualization and diagnosis, there wasn't really a whole lot of mention about money. Maybe if we talked about gambling or hoarding. But if you think about it, substance abuse involves a lot of money. People who have severe mental illness, money is involved. Even for our run-of-the-mill, so to say, diagnoses, depression, anxiety, ADHD, those things do involve money, right? So for me, when I am thinking about someone's presentation, I am taking a look at emotionally kind of where you are at, what criteria you may or may not meet. And I do use diagnoses as a clinical psychologist, but I will say that other economic problem, which is a Z code, is something that I do utilize a lot because it's typically applicable for most of the people that I'm seeing.
Even that, though, I think is helpful to throw out there. Like, did you know that that's a Z code?
Yeah, it's buried down in the back there somewhere.
Yeah. Yeah, no, I'm actually really glad that you brought that up because it's so easy to overlook. And we often think about like, oh, this is somebody's quote unquote station. This is their station in life. This person has a lot of privilege, has a lot of financial flexibility. And I think we are often attributing financial health to financial security. Can you speak a bit about the disordered relationship with money and finances, and like how do we tease that out to be like, oh, there's something here that we need to work around. There's some, as I say it with clients, there's some algae being pulled up from the well. Like there's some old stuff that's down there that's really deep and it's coming up.
I have so many thoughts on that. So first off, what I like to do is dispel the myth. Just because someone has a lot of money does not necessarily mean that they are financially healthy. In fact, about half of the people who make households who make 100,000 or more a year are living paycheck to paycheck. And that has been the standing statistic for the last couple years now, at least. So I like for clinicians to throw the concept out of the window that, oh, well, my client seems like they're doing all right. That doesn't necessarily mean that they actually are, which is why it's important to ask, and which is why I like to include or encourage people to include that question on intake about how comfortable are you with your financial situation. In terms of things being disordered, we know about if something is too much or too little, then it's probably a problem, right? If you're thinking about your money too much or too little, then it's probably a problem. Is it also tied in with your schema, how you see the world? So I think about one of my clients who is struggling with low self-esteem, and she also underspends, which is a concept that we have in the financial therapy world, where you have enough money, but you don't spend a whole lot of it. She underspends, and it's tied to her concept of her worthiness. So if I were just a standard clinician who was working with someone with low self-esteem, and I was not necessarily asking about spending habits, I may not know that. And that's really important information, because not only can I work with her to increase her self-esteem, her self-worth, but also to be able to spend some of the money that she worked hard for.
We're so often thinking about spending in excess. And I want to just acknowledge a point that you just brought up, which is kind of hypervigilance around money. It sounds like for you, it's looking at, just like any other, I guess, diagnostic assessment, how much time or energy is spent in consideration about this thing. So if I'm looking through the lens of an addictive disorder diagnosis, that is one of the criteria, that there's an excess. I mean, excess is relative. I think that's what's difficult. An excess amount of time spent thinking about or recovering from or whatever it is of a certain substance or behavior.
As well as the impact that it's having on your quality of life and your relationships.
That was exactly what I was thinking, that it's like really when we're looking at this from a functional perspective, it's not just, oh, there's this behavior and I spend a lot of time at night worried about making enough money, let's say. But from a functional perspective, I'm able to fall asleep. It doesn't really affect my relationships. And generally, I would say I'm happy, quote unquote, happy, whatever that means for me. Then for you as a financial therapist, you're kind of going, okay, we're not seeing as much financial fallout versus, I'm imagining disagreements with loved ones because they want to go out to dinner for somebody's birthday. And I'm saying, no, I can't. But I have this fancy new car, and that's where I chose to allocate that money. You're smiling. Can you speak about that a little bit? Because these are really complex things.
Have you been in my therapy sessions?
Yeah. No, I've been in mine. These topics do come up. Conversations about, I am dating somebody new and I noticed that the person just waited when the bill came. And that's loaded. Like there's a lot of interpretation there. Then there's the cultural element of what does your family say about this? What do you say about this? How about that person's family? Maybe you're brand new to this prospective partner, so you've only met them once and it's like, oh, well, I'm not going to see them again. And it's like there's a lot of stuff in our money beliefs.
Yeah, and I think that most people don't recognize that there's a lot of stuff because we don't really stop to think about why we do what we do with money. Once we get there, then we start to realize, oh, wait a minute, hold on. This is not just about me. This is also about my mom in the grocery store struggling with what she's going to put back because she can't pay the bill. This is also about my grandparents and what they were able to do or not able to do for my dad. Like it is a major thing that we are not necessarily privy to until we stop to think about it.
I appreciate your example earlier in bringing up the pandemic, and even just thinking for myself, my relationship to food changed, as I'm sure it did for many people. But like I remember driving around trying to find eggs, trying to find milk for a toddler who was, relying on milk for part of a diet at the time, and that changes you. And it also is a reflection of privilege. Up until that moment, I never really had to drive around looking for milk. It was just magically available. And then to have this paradigm shift of, well, I mean, come on, how many memes are there about toilet paper? How much were people paying for a roll of toilet paper? Which also had a financial impact. It's like how much of these basic needs were we not able to gain access to in that particular time or at any other point in time? And a lot of these things are about money, as you pointed out. It's like, oh, I want to ride out the pandemic at my beach house is a lot different for the person who has lost their home and is having trouble paying the rent and now may lose their home as a result of the direct fallout from the pandemic. So I appreciate how clear of a picture that example paints.
Yeah, I think over the past few years, I don't think there has ever been another time in this generation where we've thought about eggs and the cost of eggs.
Yeah, and the scarcity of obtaining them, but also the idea that, well, if you had enough money and enough connection, then you could, exactly, then the world was full of eggs. And that obviously opens up a bigger conversation about the economic impact and haves and have-nots and all of that and basic needs. But I think it illustrates just how deep this runs, because I notice to this day now, if I find a food that is sometimes hard to come by, I'm like, buy a lot of it.
Yep. Me too.
And then I come home and my husband's like, you have 4 of those boxes already. And I'm like, I know, but they had it at the store.
And we don't know when they're going to run out, right?
Exactly.
Or how much it's going to cost the next time we go.
Yeah. There's like this fear now, this fear response that goes back to that idea of like money is about power and about access and trying to convince ourselves that everything is going to be okay as long as we have enough of this particular kind of graham cracker, or that we just have enough money in general.
And in my clients, that preoccupation goes to an extreme. It goes to constantly thinking about or being worried about money or constantly neglecting to look at money. I think that that's the distinction there between pathology and what we could possibly consider to be a normal response to a pandemic.
Even that framing, I think, is helpful because all of these belief systems, or not belief systems, but these behaviors are there for a reason. And I think that is probably an important part of like the appreciation that when we don't check our finances and we're kind of hiding from the phone call from our credit card company, we're doing so for good reason. It's not just because we're trying to ignore our problems. It doesn't make the problems go away, but it would signal to me that our situation has exceeded our ability to cope with it healthfully.
Yeah, Absolutely. One of my favorite activities to do with clients is to have them write a thank you letter to their debt
Huh.
because it served a purpose. And when they start to reflect on what that purpose is, they are often able to reduce the shame that they feel around the debt and acknowledge, yes, my debt, while it's not a great thing that I have it and I have to get out of it, it served a purpose for me. And for a lot of people, it helped me get through a really difficult time, or it provided for me and my family when I could not. And it helps to shift the perspective a little bit.
I really love that idea, that intervention of writing a letter to your debt, because I think money is so often associated with shame. You had mentioned the idea of a money script, and you had brought up the idea of avoidance and also worship. Can you speak a bit about the other two, being status and vigilance, and how those might show up in the way that clients relate to money?
Yeah. So the vigilant folk, I like to pull from my real life experiences. So a client with money vigilance is checking the bank accounts or the investment accounts multiple times a week, if not a day, keeping tabs on everything. And there's this undercurrent of anxiety about, do I have enough? Will this be enough? Am I safe? Am I secure? And that can also get in your way. It can impact not just your ability to regulate, but if you're in relationship with someone who is not as vigilant, then you can have conflict. There's one couple that comes to mind. I did not work with them personally, but I do know of their story where they were both vigilant and they were both checking the accounts multiple times a day and stuck there and not able to enjoy their life, not able to be in the moment, be mindful, go out and just have great fun experiences, and because they were so preoccupied with what they have and what they're doing. There is the Financial Independence Retire Early community, which it's the acronym FIRE, and they tend to be in that camp where they're preoccupied with getting to the end goal, which is investing enough money to be able to quit their job and move on with their lives. So those are examples for the vigilant crowd. And then status and worship are very similar. So I mentioned tying your self-worth to what you have, how much you have. And for folks like that, they have a hard time with not having enough. They also spend a lot of time with figuring out, okay, how do I level up? And leveling up is not just you, it's also what you have. And so those are some examples. What I like to let people know when I am talking about the money scripts is that there is no good script or bad script. There is no good or bad. People just kind of fall into these categories across the board. For me, what matters more than what your script is what are your struggles and how can we get you to a better place? That's usually what my focus is on.
Thank you. And so thinking about these different scripts, avoidance, worship, status, and vigilance, we all have a script or a combination of scripts. So it's kind of like personality type, for example, like, oh, I'm an ENFJ. There's nobody that is devoid of personality. So do we basically need to understand we all err to one side of this or multiple sides of this, and that frames how we approach the world?
Yes, absolutely. And once you recognize that, then you could be like, okay, well, is this working in my favor? Am I satisfied? For instance, I am an I type. I am not an E. I am an introvert, not an extrovert. And so if I spend a lot of time around a lot of people, that's going to impact the quality of my life, right? Similarly, if having the latest and greatest Stanley Cup or iPhone matters to you. And that is closely tied to how you feel about yourself as a person, but you're struggling financially. Is that working in your favor to go out to Target for the 5th time this week? Those are the kinds of questions that you have to ask yourself.
There's so much here, and I'm sure that for you, because you're so specialized in it, you're probably really good at linking it back to money. And as we're talking about it, I'm hearing money plus shame, money plus trauma. Just seems, those two things seem like really big themes about safety and security. When you're working with somebody, not so much from the financial therapy part, so not in the sense of, okay, let's pull out your budget and go through and see where you can trim out 2 coffees a week, let's say. Not maybe that nitty gritty, but the foundational stuff of like, let's understand where some of these belief systems come from. You mentioned Maslow's hierarchy of needs. What other models do you pull from to build that insight?
Yeah, for me, I am primarily CBT and family systems oriented. That's where I grew up. That is the neighborhood that I am familiar with. That is the way that I see the world when I am doing my work. And so that is the foundation for how I conceptualize what people are going through. Yeah.
And systems looking at the relationship that people have with community, with status, with their partner or close loved ones. So yeah, how all these pieces fit together to create where we are now. And then I'm guessing maybe gently challenging some of those that may be belief systems from 3 years ago when I'm hoarding graham crackers, from 20 years ago, and understanding that maybe we're holding on to belief systems that served us for a time, as you said, like a thank you to your debt, but may not be serving us any longer.
Yeah, absolutely. And because money is multi-systemic, it also is helpful for me when I think in a family systems lens. And the certification through the Financial Therapy Association is very heavily family systems oriented as well, which I really appreciate. But it helps for me to remember boundaries. Boundaries come up all the time in my client sessions. You have diffuse boundaries. You have folks who just need help with figuring out what are the boundaries that I need to put in place for myself, as well as for the people in my life. That can be really helpful work to do as well.
And for you, when you're assessing somebody's financial, emotional health, it becomes about functional impairment and that they're perhaps not spending as much time or energy worried about money, or that they just simply feel more secure. So I'm almost, the word I'm coming up with is resilience. Like, are we just kind of trying to build emotional resilience where it's like, I have a plan and I can deal with it, and this is what I would do if I lost my job, or if that, opportunity didn't come through, or if we're not able to refinance?
Yeah. A lot of people who are coming for individual financial therapy really struggle with emotion regulation, just the basic coping skills. And when we think about money, it creates feel-good hormones or not so good hormones in our body, right? When I think about overspending, and I talk about this often, you have the dopamine rush. Even if you don't buy it, you just put it in your cart. You feel that little rush, that little surge. So for them, it's really helpful to understand there are other ways that you can calm yourself down or feel better emotionally that is not tied to money. And for those who are so overwhelmed by the negative emotions that they experience, being able to quell those in order for them to be able to look at money. So yes, I'm definitely having a lot of conversation around emotions, regulation, encouraging resiliency, helping them get to a place where they are more resilient. And from there, not only will they be able to have a clearer mind in order to have that prefrontal cortex going and help them with planning and organizing and putting things in place where their money is concerned. But they will also then be able to have healthier relationships with the people around them around money. So one thing that we haven't talked about, we haven't talked about this yet. There is financial enmeshment, where you and multiple people, one or more people, is enmeshed around money. There's also financial dependence, where, for instance, I just saw an article come out this morning that just under half of adult children have their parents financially providing for them in some way, shape, or form. I believe the average amount that they had found was about $1,400, which I found really interesting. That seems like it would probably go towards someone's rent if I were to think about it.
Is that per month?
Yes.
Oh, how interesting.
Yeah. And so when you think about family dynamics, you also have elderly parents who are having a hard time separating financially from their children, or having to provide for their grandchildren. And so being able to become resilient means not only am I strong and sturdy enough to take care of myself, but I am also not going to necessarily have negative relationships with the people around me as I might have in my past.
Thank you for bringing up that point about relational impact, because that's such a significant part of how money comes up, but also how it's coming up in our offices, on our couches. I mean, who hasn't been at a dinner party and then the bill comes and then it's like, so do we split it 7 ways? Like, there it is. There's that weird stuff about money.
Earlier this year, the media was hounding me around Valentine's Day because so many people wanted to write pieces around money and dating and when to have the money talk with your partner and financial red flags when you're dating. Those were really hot topics in February for me. And every single one I said, our conversations around money happen very early on, whether we're paying attention to them or not. Just like for clinicians, the money shows up before you have even realized it. When you go on that first date, you're talking about money without talking about money. Where you go, who's going to pay for it, all of that stuff. Yeah.
Absolutely. Yeah, they're really deep ideas. And you saying that reminded me, I was talking with someone where an older family member had discouraged somebody because of a opulent decision, that it was like, oh, you did this thing and like, oh, people are going to be judging that. And the younger family member said something to the effect of, but anybody could look at me and know that I have money. And this is how I'm choosing to use it for the few people who are aware of how I'm using it. You know, it's not like I'm blasting this on social media or whatever else. But it was such a perfect example of these generational belief systems of it's okay to have money, but don't talk about it. But it's like, but we're all kind of walking advertisements for how much money we have. How old are our shoes? What brand are our shoes? All of those things paint a pretty clear picture, often rather rapidly. And I appreciate you coming on and talking to us about this, because this is so complicated for clinicians who are listening and want to learn more about financial therapy and how we can better equip ourselves as clinicians to support clients in conversations about money and also developing financial resilience. What's the best way to do that, Dr. Traci?
Yeah, so there are a few really good resources. The Financial Therapy Association has its own journal with evidence-based research that goes back quite a ways. So you can often find answers in there. There are also a few key textbooks. One of them, off the top of my head, is Facilitating Financial Health, and that's also really helpful. The body that does the accreditation for financial counselors, they also have their own journal. And as time goes on, we have more and more research that's being done in this area, which I think is amazing. I am also open to consultation. I offer that as a service as well.
Fantastic. And for our listeners, again, this is Dr. Traci Williams. And Dr. Traci, what's the best way to get in touch with you? What's your website?
Yeah, so my private practice is Pui Consulting. Pui is a tree that grows in the tropics, and it grew in my backyard, so that's where the name comes from. It's POUI, puiconsulting.com.
Fantastic. You have introduced so many concepts that I know are going to be staying with me and that I'm going to be unpacking myself. Thank you for coming on today. And again, talking about something I don't think we talk about near enough and is probably in just about every conversation we have. We just haven't really thought about it before.
Yeah, absolutely. It's my pleasure. I love talking about this stuff.
Thank you so much, Dr. Traci. I really appreciate it.
You've just finished listening to another exclusive Continuing Ed podcast by Clearly Clinical. If you like what you just heard and you need Continuing Ed credits, please visit us at clearlyclinical.com to check out our one-year membership, where you'll have access to our growing library of Continuing Ed podcast courses. Clearly Clinical, where our goal is to help you learn, grow, and shine.